Welcome to the Progressive Pulse. Today we're talking with Dr. Bill Atkinson. He's the head of WakeMed Health and Hospitals. We're going to talk with him about health reform and other health-related topics. So welcome.
Well, thank you a lot.
Well, we're really happy that you had time to come and talk to us. And I know we were just talking now about how this is such an exciting time in healthcare and with the passage of health reform. And why don't we start out with your thoughts on that?
Well, it's a great time. I mean, we've got some of the best elements of the healthcare system in the world. We're here in the United States, but there are plenty of gaps, and this is really about access and cost and quality. The law is going to take years to implement, but much of the reform is happening just with the pure threat of reform. And so I think we're going to see better days ahead for consumers and for caregivers, and it feels scary right now to everyone. But I do think once you get some of the politics from the right and the left out of it, and you get back into the mainstream and just what's this mean to the average consumer and to the average provider, it's going to work out fine for everybody.
We've talked to providers up in Massachusetts where they've really expanded care to, I guess, almost 95% of the people.
Right.
And one thing that's fascinated me is how they talk about the change in the atmosphere in the clinic or hospital or working environment, where they know when people are coming through the door that the question is no longer do you have coverage or not, it's where do you fit in the puzzle scheme, and what can I do to take care of you.
Well,
so it's interesting.
When you're in a place like WakeMed, I mean, we've always seen a very large disproportionate share of persons without the ability to pay. We're one of the largest providers in that category in the state, and we receive no governmental money to do that other than the normal Medicaid, Medicare payment for the person 65 and above, Medicaid for those persons who meet that criteria. And so for us, people still come to the door, but every year we struggle with the question of how we're going to see more and more, and we do. I think this bill, theoretically, we'll see, but we think. And we're optimistic that this is going to balance some of that out. And at least, the core costs are covered.
One thing that we're really struggling with the whole issue around payment reform and how to talk, like especially for us talking to advocates about how to change your perception that you need to not just focus on how much can I get, but what is the effectiveness and the quality of what I'm getting. And it's a hard distinction for people to make.
Well, you heard me on this subject before, but I always say Americans want the very best health care someone else will pay for. And it is the American trait. And Winston Churchill likewise would say Americans always do the right thing after they've tried everything else. And so the reality is, we have to work at this thing. We're humans, and it's never going to be perfect. But we learn to adapt, and I think we learn valuable lessons as we move along. So the answer is that we have to insist that we measure, and it's like the carpenter, measure twice, cut once. We have to be able to measure the stuff we do, and over time to figure out the science around that. Now, that said and done, one of my biggest concerns, and certainly one of the things I warn consumers about, is that we're seeing a whole industry develop around places that sort of have bogus science. There are places that are selling stars for your ranking, and hard to figure out what's happening in that black box to figure out what the score comes from. But if you hire that company as a consultant, mysteriously your stars go up. And we're seeing that in North Carolina. We're seeing that here in Raleigh, in some hospital scores and stuff. And that's no more legitimate sort of ranking than fly to the moon. And that's one of my biggest concerns. There are a lot of places popping up with that type of measurement that's not science, and it's just hard to figure out how that's done. We need very credible location sources and independent places that will show you how it's measured and how it's done and do comparisons. And institutions and physicians and others who are unwilling to be measured against those standards, might think twice about whether they're worthy of providing appropriate care.
You and I have talked about this before, but one thing that the health reform bill contemplates in this area is testing out some different ways of paying hospitals and doctors as a way to get the quality of healthcare
Sure.
up. Could you talk a little bit about that?
Well, I think one of the best examples is bundling, or the term bundling, and we've heard it before in healthcare, but probably not to the extent it's being used today. And bundling is really it's a stretch of the use of the term, but it's a co-op of the service. It means that you're basically taking the physicians and maybe the ambulance service that's doing non-emergency transport, and you're taking the hospital and the rehabilitation hospital, and if somebody has a fractured leg and they're going to need all of those services, you probably are not covering the 911 response because that's not predictable. So I don't think it applies to fire rescue and EMS. But beyond that, once a person's in the system, you theoretically, and in the pilot programs, everyone will volunteer to do this and be compensated for it, mind you. But you would say that we're going to put a certain price tag on what we can deliver that service for. And that would include all the doctor visits, all the materials, the home health, the rehabilitation, the surgery, and whatever that bundled price is, you know, that's what you're going to be paid. Right. If it's more than that, it comes out of your pocket. If it's less than that, then there's a profit for everyone involved, and I mean, that's how you make your living, even if you're a nonprofit organization. But you also have to assume what you don't want, and one of the big fears of the sort of capitated care in the old days, you know, in the 70s and 80s, was that people would get there by cutting corners and denying care. So you have to do, if you do bundling, it also has to be measured on the outcome. Is the patient better or at least not worse? In other words, have you done within the standard of care what is best for the patient? And if you do, and you can do that with savings, then the savings are shared amongst everyone, including the consumer, who should get better faster and have a better outcome. It's a great concept, easier to talk about than do, because you've got lots of people who haven't necessarily worked well together in the past, and we're going to have to work that out. But I know at places like WakeMed, we're excited about the opportunity, and we'd love to be one of the first pilots in the nation to do it. Everybody that's in healthcare is pretty well compensated for what they do, so nobody can complain about being in healthcare. We're very fortunate and blessed to have had the opportunities educationally and otherwise to be here. But that said and done, it's a pretty full day for most people that take this on as a living. But we're here, I think, for fundamental reasons that are beyond just making a living or volunteering. It's about feeling like at the end of the day you've made a difference for somebody, and hopefully a lot of somebodies that are out there, just people that you may never know their names, but folks in need. And to invest as much time and energy as hundreds of thousands of people do in this nation to be part of the healthcare delivery system, and then feel like what you're delivering is less than a very good product to the consumer that truly helps them, it's not a good way to go home at night and think about what you've done. So I think we're all excited about trying to take the parts that are good and make them better, and take the things that perhaps need some fine-tuning and truly fine-tune them based on the best science, the best technology, and the best knowledge we have about how to do that. Don't guess about it, but there are just so many experts out there who can help, and just apply common sense to part of what we do. And there's never been a better time to be in healthcare than today, I hope, for consumers and for providers.
Thank you.